let's answer to the question number 16. It says, why are viral infections not able to be treated with antibiotics? The answer is given on page 596. It says antibiotics such as penicillin are effective against the bacteria because they target the structure such as cell wall, but there are no equivalent structure to target in the viruses. This is why antibiotics are not effective against the viruses. In a sense, viruses are stripped down structurally that there is little for a drug to target. So because there is no cell wall into viruses, antibacterial drugs doesn't work for that. Question 17 says, with reference to the structure of the influenza virus, explain why it is possible to suffer from the flu several times during a lifetime. It means why when you are infected by the flu virus and your body defeats the flu virus by making the antibody, it doesn't make you immune because the antibody present in your cells. So why you again catch the flu? Okay, the answer given on page 597. It says the virus has two specific proteins, hemagglutinin H and neuraminidase or N. The virus, including the flu virus, can mutate and they can make different type of H and N proteins. So they can make many different new strain of the virus, such as H1N1, H5N1, or different combination of these subunits of the H and N. So you may be infected by the new or mutated type of the virus and you can get the flu again because your defense system has not antibody for that new virus. Question number 18. Explain why the antivirals Tamiflu and Relenza must be taken within a very short time after the appearance of the symptoms of flu. Okay, because both of these medicines prevent the virus from escaping the cell, but they don't stop the virus from entering the cell. So that's why if the infection is not stopped early and if you not take these medicines early, too many of the viral particles have already been copied and they released, so they can enter the other cells without the action of these two medicines. Question number 19 says, discuss some of the challenges and successes in the global response to the AIDS pandemic.
With this type of the questions, maybe the answer is not directly given in the textbook, but based on the knowledge that you got from the textbook and your general knowledge, you must be able to answer to this type of question. For the HIV, the challenges that we encounter is the cost of the antiretroviral medicines. They are very expensive and maybe it's not affordable for some patients. That's why another problem that we have is distribution and availability of the medicines. Although we have the treatment for controlling the AIDS, but because these are very expensive, maybe some countries or some patients cannot use that one. Another problem and challenges that we have is the patient compliance in multiple drug treatment. They must obey the plan of how to use these medicines, and as we said, these medicines have to be used through the whole life, so we cannot stop that one. Another challenges that we encounter is social cultural issues that there are available in some countries. For example, in some of the countries, announcing that a person has a positive HIV can cause a lot of problem for that patient. So that's why that patient doesn't say that it is HIV positive, and that's why it can be easily transfer the disease to another person. But we have some successes in the control in HIV and the treatment of that. The first successes that we have to mention here is the viral medications that we have made for the HIV, especially the combination of the ARV, ARVs medicines, and also the better screening systems that we have in the different countries. For example, in the UAE, for renewing the visa, they take the medical test from the applicants, and one of the tests that they do is the HIV test. And also, we can control the infection through the drugs.